Hello, welcome to exercise 1-3. We're going to do our laying down position and we're going to progress. So we did our relaxation, we did our engagement of the muscle group for our brace during our heel slides, and now we're going to up the ante a little bit. If you have a squishy ball, use it. If you don't, you can use a pillow or a bolster or a rolled up towel, something like that. We're going to come down onto our backs again, and your feet are planted on the mat, your knees are pointing up to the sky. You can, of course, have that towel roll underneath your low back or your neck. And then from here, place the ball in your right hand and then cross your body so that the ball is pressing into your left thigh. Take a breath in, 360-degree breath. Exhale, push the ball into your thigh as you brace, as you contract your pelvic floor from the bottom up through your core. And then you have the option as well of lifting your head. And this will add a little bit more pressure, a little bit more oomph behind your movement. Good, take a peek at your stomach, and we're holding here. Notice if you're having that bread loafing appearance where the rectus, the front abs take over, and you have that doming. We want instead to contract the TA first to create that firming and flattening and a more balanced core contraction. Inhale to release, relax down. Left hand has the ball over on the right thigh. Exhale, push your hand into your thigh as you contract your core and pelvic floor, and then option to lift your head, pressing a little bit more firmly. Make sure we're maintaining the pressure. We're not feeling a lot of heaviness down through the pelvic floor. We're not seeing any coning through the linea alba. Inhale, release. So coning is a little bit different than doming. Coning is where you, instead of having that bread loaf appearance, you have a protuberance here in the middle of your linea alba, which is a line of fascia right in between your rectus abdominis, so in between these muscle groups. This is what is affected a lot with diastasis recti. So keeping an eye out for coning. Okay, inhale, relax. Ball is in the right hand. Exhale, push the ball into your left thigh. Lift your head. Now, if everything looks good and you're able to stay here, take another breath in. Underneath your bracing pattern. Exhale, let it go. Stay here for another inhale, and if you'd like to make it harder, think about lifting your right foot off the mat. Inhale. Exhale. Release all the way down. If that foot lifting off the ground leads to any compensations, just skip it. Progress at your own pace, just using the ball at first. So left hand has the ball. Inhale. Relax all the way down into your pelvic floor. Exhale. Push the ball into your right thigh. Lift your head. Engage pelvic floor and core. Everything drawing in towards the center. You feel that corset action. And we're staying here for another breath if you can contain it. Inhale. Exhale, push a little firmer. Inhale, stay for one more breath. And then option on your last exhale to lift your left foot off the mat. Good. Inhale to release. So we have a few progressions there. You can just do the ball, you can do the ball with the head lift, and you can do the ball with the head lift and the foot lift. So find what works for you. Take your time progressing through these movements.